Well, I think we'll go ahead and call our meeting to order. Good afternoon. I'm Kay Leach, and I'm serving as chair for the Board of Health. With me today are the other Board of Health members. One isn't here yet, but will be joining us shortly, I hope. I'll ask them to introduce themselves to you. Ashley, you want to start?
Sure. Hi, my name is Ashley Craner. I'm currently the vice chair of the Board of Health, and I'm just happy to be here with everybody today.
George
Hageman, retiree from the biology department at IU, a microbiologist, been a board health member for a number of years.
Mark.
I'm Mark Norrell. I'm senior lecturer at Indiana University. I teach healthcare management and policy at SPIA.
Steve.
I'm Steve Pritchard, retired dentist, and been on the board for a number of years.
Carol.
Carol Tlukin, retired pediatrician. I've been on the board for a long time.
And with us, is he here? Anybody see Dr. Wren yet?
Not yet.
Okay, but Dr. Bob Wren is also on our board and should be joining us shortly. Also, I want to introduce Penny Caudle. Penny, I can't see you, but I know you're there. Would you like to introduce yourself? Penny? Does anybody see Penny?
I see her name, but not her person.
She's on the list and she's not muted, so I don't know what's going on.
Maybe she stepped away from her desk for a minute.
Could be. With her, I think it's Dr. Sharp. Dr. Sharp, are you there? Okay, I know they're here. They're going to be joining us, but apparently not available right now. Margie Rice is also with us. Margie is our legal advisor. Hi, Margie. I can see you. I can see you.
Yep, I got a little weird configuration. I'm at my desk in the courthouse today, so it's a little different for me, but happy to be here.
I'm on an iPad, and it's very, very different. I can barely see. I can only see the top of my head, and I can barely see everybody else. Okay, well, first of all, on our agenda, we always start out with public comment. And if there's anyone out in the public that would like to bring an issue to the board, we invited them to do so. We do limit the time to 3 minutes. If you would like to bring an issue to the board, please raise your hand at the bottom of the screen and we'll recognize you. Anybody want to bring an issue before the board or a comment?
Hi, I have my hand raised.
Okay, we do have one, Doug Schroeder, I believe it is. I can't see very well at the bottom of the screen, but Doug.
It's Steve who's first.
I'm sorry, technical.
It looks like we have Steve who is the first commenter. So if you want to go ahead, Steve.
All right, I'm sorry. Steve, whoever Steve is, I'm sorry I can't see you, but would you go ahead, please, and give us your comment?
Yes, and fast. I sent an email with all the research, medical journal research, for people who read the medical journal studies and the virologists and that to follow it and read them. The masking works when people are coughing and sneezing, or if you're taking care of someone coughing and sneezing. Otherwise, the buildup of viral, bacterial, and fungal particles in our nose protects us against onto our masks, and then rebreathing it in appears to increase respiratory diseases, increase mortality, and the depression from the lack of oxygen, but also just from this process seems to increase child, adolescent, and adult suicides. That's why overall the mortality is higher for people who mask versus not. And if masking worked, someone pointed this out, then all of the Asian countries, including Japan, who mask up all the time, would not have had the crisis during the Olympics and all of the, and all of the communication then. That was all. That's actually a small thing. It's more the research shows that the number one study ever done was on the flu virus, and it came out in 2020, the biggest or the best, highest quality study. And this virus is much smaller than the flu virus, much easier to get through masks. That's why every time that that they talk about masking to protect against this virus, it only works when we're coughing and sneezing or taking care of someone coughing and sneezing.
Thank you, Steve. Do our board members have questions from Steve?
And this is Mike Biggs. Steve is just what I had put on once, and it stayed.
Any comments from board members?
Mike, what was the source of that, please?
I sensed it's a large amount, not a large amount, but about somewhere around 30 different references, all medical journal studies. And that 2020 study that was the best, highest quality ever done on the flu, and then, that the flu virus is actually larger, and this is a smaller virus, even easier to get through masking. I'd like to stick with the medical journal stuff, because the studies are very definitive as far as whether it works or not. And the other thing that we found last year was they kept using models all of the time, and human and real world studies and also medical journal studies kept refuting the models that kept saying things like we can have transmission when we don't have symptoms. There was even over 10 million person study, which when they tracked down the 300 persons that the only 300 they could find that may be transmitted without symptoms, they found out that even those could not be found to have transmitted without symptoms. In other words, there is no transmission, just like with every virus ever found throughout history, without symptoms. So if people have symptoms, that's when they can mask up. That's when they can isolate. If they don't have symptoms, they're not transmissible. So wearing masks is once again a negative as far as survival, not a positive.
Okay, thank you, Steve. Do we have any other comments out there? Technical, do you see any other hands up?
Yes, next is Dr. Elliott.
Hi there. I don't know. Can you hear me okay?
We can hear you.
Great. You don't mind if we look at each other as well. Is that all right?
I appreciate that we are. Thank you so much.
Faces are wonderful, and I just wanted to talk a little bit about that. So the doctor is an academic title, I should mention. I'm not a medical doctor. I'm actually a historian. I do study pandemics, but 2,000-year-old pandemics. So a little bit different than a modern physician. But I would like to just share with the commission a few thoughts about masking of children. I have 3 children. They are aged 7, 8, and 9. And we actually did that on purpose, believe it or not. We actually had 3 children all together like that for some reason. But all of these children attend public school in Monroe County, and they have since they were eligible to do so. My youngest child's name is Ruben, and he is 7 years old. He was diagnosed in 2019 with something called social pragmatic communications disorder. What that means is, unlike most people, Ruben does not automatically look at faces, and he does not notice how people form words and display emotion. He just doesn't do this on his own. Now, we didn't realize this until he was diagnosed in 2019 and begun therapy. And before that time, he was impossible to understand. And because of this, other children did not play with him. His mother and I felt helpless, to be honest with you, as to what to do. And Reuben was frustrated too, and he couldn't be understood. He would withdraw from other students and other kids, and he was alone and isolated. But when we began therapy in 2019, there was a dramatic change. It was like night and day. Reuben's therapist taught him how to look at people's faces at school, and when he was playing, when he was at other activities, out in the grocery store, et cetera. And he learned to watch their mouths, see how they spoke, associate certain facial expressions with emotion. And by the summer of 2020, he had almost caught up entirely with his peers. His progress was incredible just by the practice all day of looking at faces. As you know, face coverings were required in Monroe County schools in the 2020 and 2021 school year. It took us a while to realize that what happened, obviously, after the face masking was that Reuben's encouraging and rapid progress just stopped. It was totally arrested. By the end of 2021, he regressed so much that specialists at his school believed that he has dyslexia. Now, he may have dyslexia, but he didn't show those symptoms in the previous, from therapy to when he was forced to mask. The problem is, of course, that Reuben is not able to see the faces of his teachers and classmates, and that is the problem. Now, obviously, Reuben is exempt from the mask mandate. The mask mandate makes it clear that Reuben doesn't have to wear a mask, but the mandate as written still discriminates against Reuben because his teachers and his classmates cannot remove their masks when in a classroom setting or another indoor social setting. And let me just repeat that because I think it's important to understand, because there are thousands of children like Reuben. To create an environment which is inclusive of my son's disability and the thousands of children like him with whether it's social pragmatic communication disorder, dyslexia, autism spectrum disorders, other communications disorders, other people around him must be allowed to remove their masks. So I guess I'm just asking the question, what is the county going to do to ensure that the mask mandate does not discriminate against my son as it currently does? The county's vision of public health must include my son. It can't just be about protecting my son from COVID. It has to be about my son's development as a whole human being. And so I just ask you to adjust the mandate in some way so that his present and future socialization is not harmed. And if you're unwilling to abolish the mandate, I understand that politically that's difficult. I do ask you to perhaps give schools discretion to apply it in ways which best fit their students. The state of Michigan, as of yesterday, has passed a rule to no longer enforce masking in children under age 18, in part for this reason. The United Kingdom has banned masks in schools for this reason, and many European countries have done so as well. And I just ask you to consider some adjustment to the rule or abolishing the rule so that it includes children with these disabilities. And I'm happy, if you have any questions, I'm happy to answer them as well. Thank you.
Thank you so much. Does anybody have questions at this time from the board? Thank you. Technical, does anybody else
yes,
have
next up is
comments?
Doug.
Doug, I see you on the
Yes, I'm
screen. Thank
Doug
you.
Schroeder. I'm a 40-year local pastor of Emmanuel Church here in Bloomington, and just want to draw your attention to an email that Penny should have passed along to you.
We did get that. We did get that email.
So just to highlight that, the adoption, if you read through, just asking for an amendment that is consistent with, I think, some other exemptions. And if that is not generally offered, that we would invite a inspection and a possible exemption, because we believe our environment at 25% capacity in which we're able to socially distance everyone in our congregation is in line with a safe environment and would greatly enhance the interaction of our worship services.
Board members, do you have questions for Doug? Thank you so much. Technical, does anybody else have questions or hands raised?
There are no other hands raised.
All right. Let me ask, has Penny joined us yet? Dr. Sharp.
Yes, we're both here.
Oh, there you are. It's been very difficult to see people today, and we could see your name on the screen, but we couldn't find you. Okay, we are down to approval of the minutes from September 8th. Did everybody get those?
Yes.
Are there any corrections that need to be noted?
I would move that we accept the minutes as written.
I'll second that motion.
We have a first and a second. Let's do a roll call. Board Member Cranner,
Yes.
Board Member Hageman,
Yes.
Board Member Norrell,
Yes.
Board Member Pritchard,
Yes.
Board Member Talukian,
Yes.
and is Dr. Wren there yet? We have not seen Dr. Wren. Penny, let me ask, have you heard from him?
Not. I didn't. I believe what I heard was that he would be here.
Okay. For those people who are just now joining us or who joined us earlier, we were trying to introduce people and we were not able to contact Penny at that time. Penny, would you like to introduce yourself, and also Dr. Sharp back there?
Penny Cottle, I'm the administrator at the Monroe County Health Department and have been since 2008.
And I'm Dr. Sharp, and I'm the health officer.
Dr. Sharp is our health officer. I think everybody else has been introduced. It's time now to go down to public health reports. Penny, are you ready for your report?
Yes, but we do have, last meeting you had asked for a couple of visitors and I kind of got last confirmation. So Erin Waltz is with us today from Security Pro. So if we could allow Erin to speak and give a brief update on how their follow-up is going in assisting us with complaints and just businesses in general.
Okay, Erin, I see. Could you come on the screen for us so we can see you?
Yeah, give me just a second here. How's that?
There you go. We can see you now. We can hear you.
Perfect, perfect. So obviously we've been doing the site visits here for probably the last 4 or 5 weeks. And they seem to be going really well. Again, it's a lot of education. People seem to have forgot what we did the first time. So we've been in the re-education phase of that. We've had some revisits. For the most part, everybody's doing really well with it. They're getting the signs hung up. They're getting the patrons reminded of what they're supposed to do. The individual businesses seem to be doing really well as far as what they're asked to do. It's more of the patrons that we're seeing the problems with, of not wanting to comply with the restaurants and those type of things.
Board members have questions for Erin. Erin, and we know you have a hard job out there and we appreciate all your help.
No problem. Like I say, Penny and her group have been really, really great to work with, and Margie's gave us some great input. And so we've come up with this site visit sheet that's working really well for everybody, and we're able to disseminate it amongst Penny and her group so they can see exactly what we're seeing out there, and we can take the appropriate steps to rectify anything that we need to rectify and move forward with whatever we need to move forward with.
So I have a question for Erin.
Yeah, absolutely.
Tell me, in terms of your visits, now I assume that those are both sort of planned visits and some are based upon complaints.
Yeah, so we get probably 2 or 3 times a week, we'll get a list from Penny of complaints that we follow up on. They usually, Penny and her group do a great job of reaching out first. by phone to discuss it with the individual businesses. And then we come in as kind of a follow-up and make sure that what is discussed. And it's great because we can see the notes from Penny and her group. So we can see exactly what they've been told, what they've recommended. So we follow up with that. And it seems to be working really well for those businesses. We also do the unannounced visits where we just stop into various businesses throughout the Bloomington community, throughout Monroe County, throughout the day, and just check various things.
And if you give us kind of a gut feel of how that breaks down in terms of percentages, your sort of unscheduled routine stop by versus the complaints visits. It's probably half and half of what we just stop by and do and what we get in complaint wise. So that's your total work is like you're busy, right? I mean, you're doing a lot of stuff. So half of those are from complaints. Yeah, we see that actually have to be processed by the staff at the health department. They've got to be screened. That's where the call comes in. Somebody at the health department has to talk to them and determine what the complaint is and document it, and then work with the business and then forward that on to you before that can be a site visit. Yeah, before it's an actual site visit requested from Penny and them, they go through that. They check the complaints for validity, number one. They check to make sure that what the complaints coming in. This time around, the health order is a little different than it was the first time around. So you've got a lot of people out there that are making these complaints based on what the health order was before this time, as far as the half seating capacities, the bar seating, that type of stuff. So Penny and them do a great job at going through those and making sure that we're actually chasing valid complaints. But even if they get it, a lot of times we'll swing by and check it, whether it's valid or not, just to make sure that we're not missing anything as a steward of you guys, and that Penny and them, they like for that to check to make sure they're not missing anything. Thank you, Erin.
Anybody else? Thank you so much, Erin.
I do have one quick question for Erin.
Yeah.
So, Erin, I know I think the community's biggest issues is the behavior of the public, not necessarily the businesses. And I'm curious with the line of work you're in, do you have training that you can pass along to the businesses? Have you witnessed any of these encounters? How might our public enforcement, police officers, and I don't know, do you have any advice for us on how we can address this a little bit better rather than giving in to, the misbehaviors?
So it's a tough one. Obviously with today's climate, as far as employment of people and stuff, it's tough because a lot of these businesses can't dedicate somebody to sit at the front of their store and ask people to put on masks. So it's really tough. So they're relying on signs. They're relying on free boxes of masks that they set out there. They're relying on a lot of things that, the first time around we had more people in the workforce, and they were able to put people up front of their stores to say, hey, put your face mask on. If you need a face mask, I have one. Those reminders were there, but it's really tough for restaurants. And then you get into the fact of, restaurants and places don't want to be confrontational with their patrons because, at this point in their, in the time, they're relying on those people to, support their business. And if they upset them, then what if these people don't come back? So it's a really tough thing for these businesses to work through, but most of them are doing a really good job. You see some that don't try at all, and you see some that really try. A lot of your bigger box stores, they can dedicate those people to the front. Walmart's, Menards, they've got associates up front. Lowe's will have people every once in a while up there, and it's all based on who they have available. but for the most part, they do a really good job. I mean, everybody that we've come across is trying, with the exception of a few. And I think Penny's got those names, if you want those names of the people that we find that aren't trying very hard.
Erin, somebody sent us a comment that they thanked us for the mask mandate due to the fact that they found it very difficult to tell people to put their mask on when they walked into the store. And they said by having the mandate, they felt comfortable being able to do that. Have you had any comments like that when you visited the establishments?
Yeah, we get positive comments about it all the time. We get people thanking us for what we do. We get people thanking you guys for, standing up for their safety and their well-being. Again, it's one of those things. Not everybody's going to like it. Not everybody's going to be on board with it, but you take the good with the bad and you just roll with it, and you have to do what's best for public health.
Anybody have other questions for Erin? Erin, thank you so much.
No problem.
Okay, Penny, I think you also said that IU might be here.
Yes, Graham McKean is here, and thanks, Graham. And he has a little update from IU.
Sure, not that I have time to prepare anything for any meeting, as Penny knows, but I thought I could at least give a little bit of an overview since we're a few weeks into the semester now. And honestly, I've been humbled by this virus many times. I've made a lot of predictions. Sometimes you're right and sometimes you're wrong, but things are looking pretty good right now at the university. I think we've really leveled off in terms of cases, and that's across the state, across the whole system. As you know, we have 9 campuses and 14 med centers. But really, the last 12 days, we've seen a leveling of cases. We're not seeing many clusters at this time. Obviously, we have high vaccination rates, so we see a decent number of breakthroughs, and we've seen some breakthrough outbreaks, but not just a couple across the whole system. And it's a little different, the difference of what a year makes. I think around this time, we had about 33 Greek houses on quarantine out of 41 house student organizations. And right now we have 1 case in all the Greek houses that's active. So we've had maybe 5 or 6 total this semester, which is very welcome. I think testing compliance for those that are subject to testing could be a little higher. We're working on that and doing some different things. And we've gotten that up about 8 percentage points in the last week. But we're also not seeing that cohort on fire. Those would be what we would consider the most highest risk people in our population. So since September 12th, COVID check testing is what we call mitigation testing this year. And those are the people that are exempt or unvaccinated. So since September 12th, we've had 17 positives and about 2,600 tests. So just a 0.67% positivity rate in that cohort. Symptomatic testing, we're very happy to see people vaccinated coming with sniffles and getting that checked out. And our symptomatic positivity rate at IU Bloomington, we've had 42 positives on 1,108 tests since 9/12, and that's 3.79%. So much lower than the state's positivity rate of 11% today. And then voluntary testing, that's where we send exposed close contacts that are fully vaccinated, that don't have to quarantine, but we want them to test between days 3 and 5. And that's where anybody can go get a test for any reason. So since 9/12, we've had 10 positives on 1,239 tests, so 0.18 positivity. So those things are all looking really good at this time. We've got a total of 5 people in quarantine and isolation housing in Ashton, which, we've got close to 300 beds still there. So that's plenty of room there at this time. And we're launching our big flu campaign this Saturday. Any IU constituent can come, insurance or not. Obviously, we prefer that they schedule an appointment, but we're going to be at Assembly Hall this Saturday, 12 to 6, October 12th, a Tuesday, 12 to 8, and then a Sunday, October 25th, 12 to 6, all at Assembly Hall, offering influenza vaccine as well. It is not a requirement as it was in fall of 2020, where you had to require whether or not you reported it. But we're definitely strongly encouraging it and have about 10,000 doses available for our constituents here in Monroe County. So I think that's kind of where we are right now, and happy to report that we're maintaining.
Thank you, Graham. Does anybody have questions for him from the board?
Hey, Graham, this is a leading question. What do you attribute the success, the low numbers to?
Honestly, high vaccination rates. I think personally, I was getting a little more concerned with some of once Delta hit, you could see in the numbers, the vaccine effectiveness did take a hit, but I think it's still pretty darn robust. And I think that alone, along with indoor masking and all of our campuses across the state are probably the number 1 and 2 reasons that we're seeing what we're seeing now. Because otherwise we're seeing, a lot of the behaviors, return to that normalcy of a 2019 and, seeing packed stadiums and packed bars and things like that. And so I think the vaccines work.
I have a question for Graham about exemptions. I'm not sure this is really in your wheelhouse, but can you give us an example of what's an ethical exemption?
I think that would be any personal exemption at this point, and that essentially was something that I think that was implemented after the lawsuit was resolved in the summertime. Most folks had reported by that time, so I think we have a low rate of ethical exemptions. And if you give me a second, I can tell you 3% of our cases since August 1st have been those with an ethical exemption.
Thank you.
I have a question for you, Graham.
What's an example? Like what would be the typical request? Like what the reason behind that ethical objection?
Well, they no longer require a reasoning. It's simply a click of a box. It is an option that we did have in our 2020 flu policy. And I believe at that time it was just described as a fervent ethical objection, whatever that may be.
So I don't want one is a problem.
Essentially. And those that maybe were concerned of wanting an exemption, but didn't feel that it was on a religious basis, which is the highest rate by far of our exemptions are religious.
I have a question for you, Graham, about your breakthrough cases. Have any of them, I'm sure you do contact tracing on people who you have any of them been shown to transmit significant disease to other people? And how have they been very ill? I mean, are they doing well?
It seems to vary, but most are really pretty darn mild. And again, we have that benefit of having a younger, healthy population. I'm trying to think. We've had a few clusters. One that was unvaccinated, which is a regional campus with athletic team. We did have a cluster of 7 in a dormitory, and 6 out of 7 were vaccinated. So we have seen some of that. I think most, 90% plus of the breakthrough to breakthrough transmissions we've seen are households or roommates. And that seems to be a difference with Delta. And I've gotten that feedback from Shandy Dirth at IUPUI, who does Marion County's contact tracing, that when we see Delta hit a household, it seems to blow through it. But on the whole, things are looking quite good.
Thank you.
The testing logistics on campus are, they have to be seen to be believed how efficient it is. And the asymptomatic testing, and you zoom in there and you're out of there in 2.5 minutes, as fast as you can spit in the little thing. And the result comes back like, if you spit in the tube at noon, you're going to have your result by 6 p.m. It is a sight to behold.
Graham, in some of the comments we've gotten, a lot of the public has made comments that 50,000 people in a stadium that are yelling and hugging each other and so forth don't have to wear masks, and yet people walking down the street in Bloomington, do. What's your take on the large athletic events and not masking?
Well, I can't say when I was at the Idaho game, I was one of the few in a mask. And we are requiring them. We do have them in our concession stands. While those are on the concourse, they're kind of open air. They're kind of also enclosed in a way. So those groups are still masking. And outdoors is better. What I will say is it's been a couple weeks since our first home game, and we have not seen a spike. We've seen a couple case reviews where people mentioned either tailgating or going to the game in their infectious period. Luckily, not while symptomatic as well. But I think outdoors is provides that much layer of a protection. Now, if I was in a crowd like that, personally, I might still continue to mask with that dense of a crowd outdoors. But so far, it's holding ship, and I think if we were to see something related to those events, that we would consider some additional actions.
Thank you. Any other questions for Graham? Thank you so much.
Yeah. Thanks.
Penny, I think we're ready for administrative reports from the health department.
Okay, I am going to try to share my screen. So you will need to tell me, can you see my screen?
Yes.
All right, very good. Okay, so what I want to start with is just a couple small updates. We did have a few staff who were able to attend the Indiana Environmental Health Association conference. That felt very good after, not going to any conferences or doing any of those kinds of things in over a year. To be able to attend some meetings was a good thing. Our budget was approved by council. Now budget hearings, all of that process is not complete yet. Compensation is yet to be determined, and budget adoptions are in October. I believe it's the 19th and the 20th of October. So we're not done with the budget yet, but just wanted to give you that update since our budget hearing, I believe, was the day after our last meeting. We have, and you've heard from some people tonight, we have received various emails or correspondence from individuals, some glad that we do have the mask requirements, some that we do not. I would just remind, I think the board and maybe anybody who's listening, that this order, and Erin mentioned that it's different from previous orders, but that masking in indoor public places came about really when the CDC recommended that action because of Delta and in areas of high transmission. And so that is where this current order kind of came from, because we do have a high level of transmission at the moment. And Erin's right. We get complaints sometimes that talk about people not distancing or capacity, and we do not have those in this order at this time. So what I wanted to start with today, I managed to get some slides together. I don't normally do this, but I managed to pull this off today, and so hopefully it will work well. So we've talked about testing and our community testing site. The Gravity Diagnostics site did open this week. It runs Tuesday through Saturday, 8 to 4. It is at 500 North Profile Parkway, which is Cook Group property. It is opening in order to get it here quickly. They set up a drive-through and are making plans for an indoor facility. So that will be coming. The results are back by 5 p.m. the following day, and that does not matter if it's a weekend or not. If you're tested on Saturday, your results will be back on Sunday. Because it is outside, the weather can alter the hours. So a good example is it has been raining all day, and so they did have to close today. So this week started up. They've had some hiccups, but they are working through them. One thing that I want to say to anybody looking to register for that is when you go to that coronavirus.in.gov and you find that testing map, go to the county sites. Don't just start with a zip code or you won't find it. Go to county sites, go to Monroe County, and then look for Cook. And then when you open that up, it will tell you that it's the Gravity site. So that's the best way to get that so you can register for that. The Indiana Department of Health has also arranged for another clinic at Indy Motor Speedway. That will run through October 30th, and it runs noon to 8, has both rapid and PCR testing, whereas right now the Gravity site only has the PCR. The Motor Speedway site also has vaccines. So they've got Pfizer and Johnson & Johnson available. And while supplies last, you can get your flu shot. So if you are looking to get your COVID vaccine, you can also get your flu shot while you're at it. Now, when you are registering for that site, you should use the zip code and you should use 46222, and that will populate that site for you. So that's the best way to find that. I want to go over kind of,
Can I ask a question about the flu shot?
Sure.
I've read suggest you not get the COVID vaccine and the flu shot at the same time.
Not now. They can be given at the same time.
So that's changed?
Yes. Yep. Any vaccine. Yep. Originally, I think in the very beginning, they were recommending a 2-week period between the COVID vaccine and any other vaccine. And that went away this summer, I believe.
Okay.
Yep. So. Other questions about testing? That's a good pause because, all right. So these next slides, most all of this I managed to get off of the state website for you, and I think most of you check it out. But here's our county metric. So you can look at last week and this week, we are still orange, but those orange, red, and that yellow color kind of moves around a little bit. And I want to talk a little bit about how we determine that metric, just so that that's really clear. They combine two elements. So the metrics are your cases per 100,000. This week we had 204. So last week we were at 200 per 100,000 cases. And so if you look below that, there is one county that is not in red in that metric, and that's Brown County. And they are almost red. They are 194, 195, something like that. The percent positivity is the other piece of that equation, and you can see that those are given numbers. So red is a 3, yellow, so our percent positivity is a 1, so we get a 4, and then you divide that by 2 and you get 2, and that's how we end up in orange.
Penny, I have a question about that too. Are the IU numbers included in that percent positivity?
Yes.
In the cases?
Yes, as long as they are reported with an address here, yes. And they
okay, so what this tells me is that outside of IU, our county percent is probably higher than that because their percent is so very low, and that the cases are basically all outside, for the most part, outside of IU. So
a lot of them are, yes. And I would say, much like Graham said, it's easy to see a lot of household spread and things like that.
Yeah, like we said last time, it's friends and family. So what this tells me is that the county outside of IU is probably in worse condition than these numbers indicate, because they're diluted by IU's really, really, really good numbers.
That could be.
That's how I interpret it anyway.
It is hard to separate out. Remember, IU's numbers includes the students are part of our community, but their faculty and staff are in our community. So it is hard to sometimes flush them out and separate them.
One other observation, if I could, Penny, go back to that slide on the cases per 100,000. And yeah, we're at 204 per 100,000, but if you hover over the counties that touch Monroe County, every single one of them is right around 400, or twice, to a factor of 2 compared to Monroe County.
Yeah, none of these kinds of things are perfect. And certainly when you look at that red, it's anything, it's 200 or more. So if you've got 200 or you've got 500, it's just red, right? Yes.
Yeah, so that kind of speaks against, some arguments that masks don't work. right? I mean, actually, this is a little experiment in progress that, masks do work.
Well, I think it's important that we also note that masks work alongside all the other preventatives, right? I mean, that's kind of, I don't know how effective masks alone and only with no social distancing, with no vaccines, with no anything else, but that masks definitely are showing to work in conjunction with all these other preventative measures that we're taking and other communities are taking. Is that reasonable?
Yeah, and one of the analogies that we use a lot is, and it's been used many places, it wasn't original to us by any means, is the Swiss cheese, right? That whether you're talking about masks or even vaccine, or you're talking about washing your hands, all the, Swiss cheese, each thing has a little hole in it, right? And nothing is perfect, but as you layer those things together, just what you were talking about, then you continually increase and close off those holes to get a high effectiveness. Yes. So as we kind of look forward, I wanted to talk about this in terms of projection, because remember that even as our cases improve, for us to move from red to orange or orange to yellow or yellow to blue, you've got to be showing a trend. So you've got to be in that advisory for 2 weeks. So even though, let's say next week, our numbers actually are yellow, we will stay orange that week until we have another week that's yellow. So as you look at that, it is probably going to be, in best case, October 20th before we could move to blue. Now, there could be other scenarios, lots of things can happen. What ifs, we could go all day with, well, what if this happened? What if that? But I just wanted to give you kind of a basic, this is probably what would happen in our best case scenario. And being in blue does not necessarily mean that our cases have dropped below 50 per 100,000. And that is kind of that number, 50 or higher is considered high transmission. So the next slide.
If I could just for a second, looking forward with projections is, we're anxiously waiting for the vaccines to be approved for adolescents and children. And that's when that happens and that starts to get rolled out, I think that's going to dramatically change the way that maybe I think about safety and masking and projecting forward. I mean, we'll see it in the numbers, but it would make me personally feel more comfortable, reconsidering the mask mandate. But who knows when that is, right? We can't ever say for sure.
Well, and exactly. So these next few slides do give you that glimmer of hope, kind of that you're kind of talking about. So our cases, our positive cases, you can see that there's a little bit of a dip. I think we are back, and I hate saying back down to, but I think it's at about 40 on a rolling average, about 40 a day. But we had been, I think, up in 50 or something. So you can look that back when we had those peaks, we had some kind of sawtooth. We would come down and go back up. And we very well may be doing that as well. But there is some indication that things could be potentially improving. Testing, it's not nearly as high as it once was, but it still is increasing. So that is a plus. And then I wanted to look at the hospital census. So the hospital census, again, kind of shows you a little bit of a leveling off here, coming down a little bit. Again, don't get too excited. We would expect that there probably is going to be some up and down there as well. But it is good to see that there may be some glimmers of hope out there, that things are starting to improve. So when we talk about the hospital, and you were asking about breakthrough cases, I wanted to talk a bit about the hospital and vaccine, who's vaccinated and who's not. So this is a good illustration, I think, of your hospitalizations, who's fully vaccinated and who is not, and what those numbers look like. And it clearly tells you that vaccines help, right? That vaccines work. So you can look, it doesn't mean that people don't get into ICU. It does not mean that we don't have people who die who are vaccinated, but the vast majority are those people who have not been fully vaccinated. So when we look at our own county, and I pulled this today, you can see right now we are, the last several days, we have been stuck at 59.5%. I think in the last week, we gained about 350 plus or minus people being fully vaccinated. So you can kind of see this was the previous week, this is this week, and this is those who are fully vaccinated. We do have some county or some zip codes that are doing very well. I've talked about this before. 47401 has a 71.6% that fully vaccinated rate. So it ranges from 54% up. There are a few very small zip codes that may have smaller amounts, but much of that is suppressed because the numbers are so low. We did look at some of those. Some of them also include campus and are more businesses, so not necessarily actual physical homes where people live. So we're trying to look at that, and part of what we're looking at with areas like that is to see if we are missing a zip code, for example, how we can increase vaccinations rates in that area. And is it a vulnerable area? What's their, where do they come in other vulnerabilities? So we're trying to look at that and get a better picture of that so that we can continue to increase our vaccination rate.
Penny, I looked at your vaccination rate by zip codes. I mean, by the zip codes, and the university doesn't have 100% vaccination rate like everybody's bragging about. Their rates weren't much higher than the rest of the community. Am I correct about that?
Well, I don't have that. There were, again, a couple of zip codes that are university related that really are not residences. So it's kind of hard to say about that, how that will play in, because when you look at the zip code, IU is looking at their student, faculty, and staff population, right? Who's reported that. And we're kind of looking at residences and who lives in those places. So they may have students, for instance, who are not captured in our numbers and vice versa. No perfect science. And I am not an epidemiologist, so I'm not going to pretend to be.
Thank you.
But it is interesting, right? It's very interesting to look at it and try to sort it all out. So vaccine availability, there are many options for getting vaccination. Our public health clinic continues to have Moderna Mondays, as we lovingly call them. But we've also added extra days, and other vaccine as well will be available on those other days. Ourshot.in.gov is a place to find out what days are available, where you want to go. We continue to do outreach clinics. One of the reasons that our nurses are not here tonight is that they are at the 50 Plus Expo at Switchyard Park. So we hope that we'll get some vaccinations given there. We continue to do school clinics, which do require parental consent. Those have been very slow. We had some, I think I reported at your last meeting that we essentially canceled because nobody had registered for them. That is picking up a little bit, but still not as high as we had hoped. With the nurses will be going back to do flu vaccine and those second doses for the people who got the initial vaccine. So we hope that we'll have a bigger uptake of the flu vaccine when we go back, but that keeps, certainly those school clinics are keeping them busy until late fall. We have at least, most every day, there is at least one outreach that's occurring. And that's just on our end. So that's just what's happening with us. And there are other places in the community where you can get vaccinations. And I think I've got Excel Learning Center. The other reason to go to ourshot.in.gov is that you can see these mobile clinics that kind of pop up. We have this, we tend to call them pop-up clinics because we don't often know they're coming, to be quite honest. So on Friday, they will be back at Excel Learning Center, which is at 2088 Liberty Drive. And I believe they'll also have testing, if my information is correct from the state. So those happen a lot.
Penny, I just happened to think about it while you were talking. Our cases seem to have really gone up, particularly when we were no longer able to do the testing. Remember when we had Optum and so forth? It seems like, has that been a big factor, do you think?
Well, certainly testing, you know, what happened was the Optum clinic, the Morton Street site, and Morton and Optum was across the state, right? That the demand for testing and the usage of those clinics had dropped dramatically and cases were going down when those were closed. And then August, you know, the end of July, August hit with Delta variant and this surge came. And so it was almost like this perfect storm of bad news, right? So testing has been frustrating for a lot of people and difficult in some situations, certainly. But we do have a lot of testing availability as well. You know, the Kroger, CVS's, but they were so busy, some of them were running out of tests and would have to kind of wait for a resupply. So definitely the timing was bad, but you know, given the information that was available at the time and the cost, that's what the decisions were based on. But you know, testing isn't prevention, so it's identifying the cases. You know, I think a lot of it, and I've said this before, is I think a lot of it had to do with, we talk about it spreading through families, but I'm not sure how well people have continued to quarantine and isolate within households as well. And it can be difficult, let's face it, it is not an easy thing to do. So the next thing, you all are very well aware that the third doses that have been out there for moderate to severely immunocompromised individuals, there's a short list. Those are available now. Pfizer and Moderna are the only two vaccines that are approved for that third dose. And it is 28 days after completion of the initial 2-dose regimen. So if you are immunocompromised and you think you fit that third dose and you haven't received it, talk to your healthcare provider and they can help you determine if you meet that criteria. But all the buzz is about the booster doses, and the booster doses are really about getting an additional vaccine after the immunity is waning. We talk about waning immunity for this, and this is what's being discussed right now. There's a process, and this is the one thing that I wanted to make sure that everybody was aware of. There's a process for how these are approved. So there's a committee, the VRPAC with FDA, that made some recommendations, right? And then that goes to the FDA for an emergency use authorization. And at this particular time, this could already be done because I've been engulfed in preparing for this meeting. So we say anytime, this could have happened while this afternoon, but this is where we were in the process this morning. The CDC ACIP committee, they are the committee and they were scheduled their meeting today and tomorrow. Once that EUA, assuming that that is given, this ACIP is the group who will determine how this is all done. So I've heard people ask and say, well, I understand that they approved, they recommended vaccine for high-risk occupations and conditions, but I don't know what they are. That's because it's ACIP that will make those determinations, right? So that's all yet to come. We are prepared to do our part. The state is prepared to move forward with vaccinations once we get all of those recommendations and directions. And then someone mentioned a timeline for children and Pfizer vaccine. Again, there's a process for that. And it will kind of start, it probably could be, they say, as early as the end of October or something like that, but we'll see. It is a smaller dose of vaccine for those who are 5 to 11. So just wanted to kind of give you that. And I do believe that's the end of what I wanted to share with you. But I wanted to give you that. We got some of those updates yesterday. That's it.
Okay. Well, we're down now to old and new continuing business, and what we have listed under that is the regulation review. Penny, do you and Margie want to say anything with that?
Well, I will start and Margie can chime in. The current health order is set to expire on the 30th of this month, or if we were to be in blue and have cases per 100,000 under 50, we're not going to be there. So right now it is set to expire on the 30th. With the Senate Enrollment Act 5, there is a process. If you want to extend it, if you want to make changes to the order, then that new regulation would have to go before the commissioners before it could take effect. So what you are charged with tonight is to make a decision about what you want to do with this order. Do you let it expire? Do you make changes and extend it? What do you want to do? And then that way we can get that on the agenda for the commissioners next Wednesday prior to the 30th of the month.
Okay, anything you want to say, Margie? I think we've lost Margie. Board members, what's your pleasure? What would you like to see? Once again, our options are the order could expire on the 30th. We could extend it or make changes with it. Correct, Penny? All right. We're open for discussion.
We seem to be entering a phase of flattening the curve in this latest wave. And I'm in favor of extending, but I'm not sure quite how long that extension should be in view of this flattening. The flattening could be the backside of the curve, or it could just be more of the same, in which case we really need to have an extension. And extending is always, of course, easier than dropping it and then having to come back. So I think that's a consideration. I favor extension.
I agree, George. I think we need to see the numbers first before we drop it. And continuing would be a good thing. We can always drop it later.
Could I go ahead and make a motion just so we can get that under discussion, a specific motion to extend? I'd like to make the motion that we extend the current order to the end of October.
And I'm not going to second that. I wanted to make a comment. The question is, is there anything that we need to change that could be changed? I think that some people have pretty legitimate arguments or points that they're making about some of the inequities in it. Particularly, I mean, again, if it were up to me, everybody wearing masks inside all the time, and with no question, just because, you know, we know that masks actually do prevent spread of disease. Nothing else that prevents the flu, which we don't need flu on top of COVID right now, that's for sure. So I think that I think there's some situation. I think Mr. Schroeder's email, which I read and I've been thinking about in terms of indoor things. We let people go into restaurants. And what's the capacity right now that they're allowed?
There is no capacity limit, but it is when they are eating, and the difference is when they are eating or drinking.
Right.
Yeah.
So when people go into restaurants, and they can sit there and they can eat and talk in fairly small quarters without masks on. And you have a situation in a very large room where people are socially distanced and they're doing things that, you know, talking, singing, whatever. I mean, what's the difference of those two things? I guess I'm having, in my mind, I'm having some trouble with that personally.
I agree. I agree, Carol. I had the very exact thoughts that you're having, which may be scary. I don't know for you. But I thought there was a legitimate point being made concerning the seating arrangement and the seating situation. And I definitely would be inclined to consider an exemption in that case.
Yeah, I think a waiver might, maybe it's adding something that, like a waiver type of application, perhaps.
Because certainly not everybody is doing what they're doing.
No,
I know they're not.
No, I don't want to put anything blanket in there, because I think what you're doing at your facility sounds like it's as safe as it's going to be in that situation. Again, we're up to me, everybody wears masks all the time. You know.
The air handling situation and activities like singing also very strongly affect the possibility of transmission.
Yeah, if they were in the facility, they were distanced, the number was 25% or lower, and we're not singing, it would not be bothersome to me. It's the singing that bothers me, because am I not correct, Penny? That was one of the things that was listed as high transmitting.
Well, and I think one of the differences, and correct me if I'm wrong, I mean, I read your letter too, is that our restaurants, they've minimized, there's a lot of tables that they've taken out too. I mean, they're lacking on service workers, so they have less staff. They've also are still, like, when I not that I go out very often, but Uptown would be probably my best example. I'm still noticing that the tables there's still some missing. So they're able to practice social distancing within that environment. So I don't know, last time I went to church, we're all in long pews, kind of sitting all next to each other. So that would be, I guess, my question is, how do you even successfully social distance in one large room with lots of different people. I mean, that's my concern about a church service, you know. And then again, the singing, that was because that was something we were educated about. So I think that there is a little bit of a difference between the two.
I could tell you how we do it if you'd like to know.
Sure, I would love to, Doug. Go ahead.
We have every other pew is reserved seating, which means you can't sit there. And then we ask that families be at least 6 feet separated from the next family unit. So you've got the distance between the pews, and then you've got distances between families. And so we're able to operate at 25%. We can hold 500 in our auditorium, and we are at 125, limiting our services to 125. We also have very high ceilings. We have air handlers that are running all of the time in the facility. So I think if you came and visited our church on a Sunday morning, I would say we're safer than in the stadium with yelling fans.
Right. Right.
But the difference is you're inside and the stadium is outside.
That's true. That's true. Yeah.
That's true.
Hey.
Yeah. Well, you know, as Carol mentioned, I just, you know, want to kind of wrap up my little thoughts here is that, you know, I too am in favor of extending until at least through that October 20th. I mean, our initial goal was to get us into the blue. And we're kind of a little bit all over the place. I understand the science to say that masks work along with all these other measures, vaccines, highly, highly important in that sense. So, and I also am sensitive to Mr. Schroeder's situation. And rather than, and I don't know how to do this, I'm assuming Margie's still on here somewhere, if there's a way for us to include exemptions like we did before, where they are requested on a case-by-case basis, you know, a legitimate exemption, you know, I would feel comfortable with that, because then the health department and our experts would be able to make those decisions, meaning Penny and Dr. Sharp. But that's kind of where I'm at, is keeping the masks going, but making some adjustments to the current ordinance as it is for individual exemption requests.
So you're saying, Ashley, that your recommendation is extending it and then putting in additional language to have the ability to have a waiver with a site inspection or
something to that effect. Because I think we need to, yeah, I think, you know, this last ordinance, you know, we really just didn't allow for as many, you know, we don't have capacity standards. Or gathering standards. We don't have, you know, late night cutoffs at the bars. I mean, we don't have these other controls in place. And I think that if we're going to extend further the mask, which I very much to do, I also think that there should be an opportunity for, you know, parishes or other events or whatever to have something in place that we would need to make some changes, I guess is what I'm saying. So I don't know how we would do that by keeping the ordinance and then adding in any changes that the board might want to add, any exemptions or limits.
Yeah, if you want to do waivers or make changes for large gatherings, what you do have to remember is it's got to be consistent. So you've got to treat churches and other businesses the same. So in talking about a restaurant, you're eating and drinking, you can take off your mask. If you were in fellowship, the church members could eat and drink and take off their masks. So the settings are a little different. So just keep in mind, if you're doing that for another large venue, then you're also allowing that for other venues, right? You just want to do whatever that is going to need to be consistent.
If
So
we
we
were,
put-
if
Go
we
ahead,
were to
Jim.
create exemptions of some sort based on inspection by people from the health department, the environmental people, or Penny and Dr. Sharp, ultimately, that would be a heck of a lot of additional work for you guys, wouldn't it, Penny?
Yes, it would. The exemptions before, we got lots of them. Because you could be talking about weddings and, you know, depending on your parameters, you know, and what that looks like. And I certainly don't, they are doing a great job in this facility, so I don't, but, you know, to keep in mind that everything does need to be consistent is key. And so looking at that from a standpoint, and that the CDC's guidance right now is that any public indoor place, period.
It is indoor place, period.
And if I can, sorry, can you guys hear me? I had to grab a call, so I'm sorry if I missed part of the conversation. Just keep in mind that, you know, there were some cases in other jurisdictions like California, where there was a church that said, hey, you're treating me worse than this, you know, sporting event or whatever, and went up to the Supreme Court. And the United States Supreme Court's been clear. The Indiana General Assembly has been clear. The messages are all clear. You can't treat churches worse than you treat anybody else. I mean, and doesn't say that you can't treat them better. Now, let me just say this though, when you draw distinctions, you should be drawing them fairly, you know, there should not be any, you know, arbitrariness or can't be capricious. You need to be legitimately drawing lines based on some finding that you've made. The fairest way to treat people is to treat them all the same way. Now, there will people that will object and say, well, I need an exception because, again, like I have this disability, and we have written into the code or written into your regulation for those people with legitimate disabilities. I would caution you to start carving out exceptions unless you've given some real good thought about why you want to do that, and that there's some legitimate governmental interest that you're trying to achieve, and that exception is going to achieve those results. So, you know, when you're talking about these kinds of things, and, you know, I don't want to bore you with the, you know, constitutional details, but for anybody who's interested, go to the constitutioncenter.org. They have some great bipartisan materials on these sorts of things. But, you know, we are a governmental entity, so we have to be reasonable and legitimate and fair in the way that we apply our regulations. We need to treat similar groups similarly. And in this case, there's a great, you're saying indoors versus outdoors. That's a nice bright line. And that's easy to defend. And we can say, you know, the CDC recommends that, right? I think that's what, and Penny's done a great job today, laid a nice record. But Penny, I think one of the questions you'd want to ask Penny and Dr. Sharp is, do they think that indoor-outdoor distinction makes sense? And if so, why? And I think Penny has already said, correct me if I'm wrong here, Penny, that you're basing that on CDC. Now, there will be people out there will say, I hate the CDC, and I think they're stupid, and and they've been wrong. Okay. And you're entitled to that opinion, but that's a very legitimate thing for us to point to, is the CDC, regardless of what my neighbor might think about them. I really do caution you if you start drawing exemptions, and I will tell you, and one reason I'm okay with that caution, and I'm okay giving you that caution, is because I know how hard Penny and her staff will work with organizations to help them achieve their goals. We are not trying to sit on anybody and prevent them from living the lives that they want to live. And we work very, very hard to individually reach out to people that are having problems or are not wanting to comply and work with them to get compliance. We had a local gym who got complaints about. I happen to have been in private practice with the partners that are in the law firm that represent them. I reached out to them. We've got compliance. I mean, so for those people out there saying you're not doing anything or you're not complying or what about my restaurant, remember, restaurants, when people are actively eating and drinking, they don't have to have masks on. So if you walk into a bar and people are drinking, they don't have masks on, that's within the, they're drinking, they're actively drinking. That's okay. So I just want to really raise this red flag about starting to carve out exemptions, because I think it's going to maybe set no good deed goes unpunished, and it might set you up for a challenge. And also, I think you might be making the health department's life difficult. So I'm happy to answer any questions you might have.
I think, Margie, part of the discussion you missed was what Steve and I both said about, people, how is it different to be inside a big room with people spread out in a restaurant with lots of people inside with no masks on, eating and drinking and talking and shouting and all that sort of thing. And so I think that's what bothers us, is that there does seem to be a bit of inequity there.
Well, and I think the problem is that you can't eat or drink with a mask on. So unless you're prepared to shut down, I mean, what are you going to do? I mean, if you got to let people eat and drink, or you can't shut down the restaurants, right? So I mean, you've got to be practical. I mean, so I don't know if I missed part of the conversation about that. How do you deal with that?
But we know the people in there eating and drinking, they're not putting their mask on and off, whether on and putting it back on. We know they just have it off the whole time they're in there.
Yeah. Now I don't know. I mean, when I go to a restaurant, I got my mask back on when I'm not, when I'm talking to my friend at breakfast after I've eaten, I'm sticking my mask back on. But that's me. But I mean, generally the rule is supposed to be that when you're actively eating and drinking,
I have a question for Doug. In your email message to us, you indicated that some congregations, some churches leave their normal place of worship and go to a gym area or a cafeteria area or someplace where better distancing or maybe different air handling or some other kind of situation which makes them much more like a restaurant seems to generate what amounts to an exemption or at least a different environment. Could you tell us something about that? Because if your congregation would go along with something like that, that might be a possible option for you.
Well, I understand that. Yeah, you're saying that we could do that. I would first of all say I went out to lunch today at a very popular restaurant here in Bloomington, and a lot of tables were occupied. There wasn't distancing, and nobody had a mask on once they sat down, and including me and the people in my party. We visited and enjoyed each other and had a good meal. I would imagine that with the current standards, we could have a meal in our gymnasium in which we're eating and drinking and having a good time. I can move us to our gymnasium. Our gymnasium, we cannot socially distance like we can in our auditorium. And I think our people would be in a less safe environment. But yes, we could sit around tables. We could have a glass of water in front of us, and we could sing, and we could have all kinds of time. But our church would not be as safe as we are in our auditorium.
So Doug, tell me again what the problem is with wearing a mask in church service.
Well, all you have to do is speak to a group of people more than a lecture on economics, a lecture about their life, a lecture about spirituality, information, things that matter. And people, you see eyes, you're speaking to cardboard cutouts. Masks do restrict people in their expressions. People aren't not as expressive as they used to be. They're not as verbal. They don't laugh as loud at a joke. And so in a very highly personal thing, like a worship service, people are very muted in terms of their response and their interaction. That's what I would say. Singing, again, I know I would personally be much more comfortable in our auditorium singing than I would be sitting even outside, shoulder to shoulder, touching shoulders in the football stadium at IU with people yelling and screaming.
Yeah, I'm not excited about that situation either. So it's not a good, it's not a good argument for me.
Say, why don't they have to, just because they're outside, they are, I mean, you're touching, you've been to the stadium, you're touching people.
Well, I think part of that though is that they're, they have there's a high vaccination rate and they're all adults. In part, I mean, we're not, it's not a school setting with young children that don't get to make, health decisions for themselves, but I think what Margie brings up is a good point. And I think the health board, we care about all of this. And I think our numbers just aren't cracking it yet. And, the mandate seems to be helping because masks help. I think businesses like Margie had mentioned, where we point to the CDC, the businesses point.
Oh, Ashley froze.
And we're really looking at it, and we're looking at really another 30 days, another month of this. And if we can, in 30 days, we got to beat this pandemic somehow, or we're all going to be wearing masks, I think, forever and ever. And we might very well be, but I just, the people that are getting sick and dying are concerning for me. And also everybody's frustrations with all of this is concerning to me. And I truly hear you and the people that want to enjoy their church services and get that full effect. I understand that. But I think the board, I guess after hearing Margie talk a little bit more, I wish we could just give exemptions and make everybody feel better right now. But for me, I think I'm just gonna probably just stick to the next, probably will be voting for the mandate just to stay in as is for till the end of October. And hopefully we can see our numbers improve around here and throughout the state.
One thing that I anticipate happening hopefully at some point is that our vaccination rate will get up high enough that we can actually make exemptions based on vaccinations. I mean, right. That's certainly one thing you can do in your church, Doug, is to encourage people to get vaccinated. If you had a 100% vaccinated population, it wouldn't be a problem.
I mean, are you telling me if I can prove that we have 100% vaccination rate that we don't have to wear masks in our service? Is that what you're telling me?
We haven't gotten to that point yet.
Yeah.
If I could prove that, would that make a difference?
Not today, because the population in general doesn't have a high enough vaccination rate.
Well, and Margie may be wanting to interject here too. One of the new legislations prevents us from using what they call vaccine passport, but we cannot, as a government agency, make that requirement. So certainly a business could say, we're not going to admit somebody who isn't that you've got to show proof of vaccination to enter, but we as a government entity can't put that into effect.
That's right. And we do have, there are, and not only, do we have to think about constitutional issues, but we also have to think about state law issues. And our General Assembly has stepped in and passed some statutes sort of limiting what we can and can't do. And so one of the things that, I'm going to throw it out there just as a devil's advocate, because I think it's probably in somebody's head that's in the audience is, and maybe you guys talked about this when I was on my phone call, but, certainly an approach, I'm not saying that the Board of Health should take this approach, but certainly an approach could be, we've tried this with masks and this is where our numbers are going. We've had this mask mandate and look, we went from, yellow to orange and our numbers are increasing. We've had this mask mandate. You certainly could say, okay, we're going to remove the mask mandate. We're going to see where our numbers go from there. And at any point in time that we feel like, whoa, we got to put that order back in effect, within 48 hours, this board can call a meeting 48 hours notice and put it back in place and say, we needed to do this because our numbers are going crazy through the roof. Of course, now, because of the way state law is, you have to go to the commissioners. You'd have to get that approved by them, but they also can call a meeting within 48 hours notice legally. That's all that's required to get a commissioner's meeting scheduled. So I'm not suggesting you do that, maybe, but thinking you certainly could talk about it. One of the approaches would be if we did that and we removed this and just said, okay, we're going to, not do the mask. We're going to focus on, turn our efforts to something else like vaccination and then see where our numbers go. And if we need to reverse course it and put this mask mandate back in effect, we can. Now, of course, people are going to say, wait, you're changing the rules and I get all confused and, I don't know what's what. Well, again, that's not that confusing. It was in, it's not in, whatever. I mean, so just pay attention.
Here's my question about, because there was a thing we talked about last time about in a school setting, if there were 100% vaccination rate with no medical exemption, with no exemptions whatsoever, that they could not wear masks, right?
No, they wouldn't have to. If everybody in a classroom is masked, they don't have to quarantine.
Quarantine, that's what it was. I trying to remember what that was. Okay, that's what it was. Okay.
Yeah, and to be really clear, in that instance, they all have to be masked, no face shield. Face shields are not okay.
Okay, I think that's yeah. Okay, that's what I couldn't remember what we were talking about there. Yeah. Okay.
Well, and this came up. Our current regulation does allow for a clear face shield. And then there are some masks with a clear view around the mouth. So there are some options. They may not be ideal, but there are certainly some options that we provide that, for instance, in that school scenario, it is not allowed.
And I did put in the chat, if anybody wants to look I put the clear surgical mask link in the chat. Also to Pastor Schroeder, I'd like just to point out what Penny just said, just to make it clear, is our regulation is a little different than CDC that doesn't allow for face shields. We define face covering as including a shield. So, that is something that, anybody right now could be complying with our regulation by wearing a clear shield and not a mask. So for those people who are worried about the expressions and being able to see what people are, their emotions, I would recommend getting one of those clear face shields because then you see your whole face. And that's totally allowable right now with our regulation. Isn't that correct, Penny? Correct me if I'm wrong. It's totally okay. This is a matter of choice that people are saying, I'll take a mask rather than a face shield. The whole world could, in Monroe County, could start wearing those face, if you felt comfortable with it, could wear a shield instead of a mask.
That kind of solution would also be responsive to Dr. Elliott's problem. Of course, the problem is you'd have to provide such shields for the entire class. And that, of course, would be something that could be done.
Yeah, I think that's not necessarily going to work with kids in that situation. And I do want to say something to Professor Elliott, just because I'm very empathetic with your situation. I have a developmentally disabled 3-year-old granddaughter who does not communicate except through facial expressions and that sort of thing. And as a family, we've had discussions about this. She's not required to wear a mask because of her issues. But we've talked about the greater good, I guess is the bottom line. I think it's awful. I mean, it's terrible. I totally agree with you. It's a real problem for my granddaughter because so we just spend as much time as we can when she's not in daycare or preschool. At home we don't wear. She has interactions with lots of family members. We do our best, and she's in special communication. I mean, she can't speak, so she uses eye contacts for communication. So we just do all we can do to keep her stimulated outside of that setting, because we don't. I mean, as a group, as we've discussed this as a family, we don't feel we can it's so important to keep his kids from getting sick from COVID, and it's getting worse. And even here where we have a mask mandate is getting worse. And I have huge amounts of sympathy for you. I really, really do. But I think sometimes it's we just have to do what we can do to adapt outside of that. I mean, there's a whole rest of the day to work on issues, and I do appreciate it's a problem for him. I really do. But I think that, you know, and I don't think it's practical to have the whole classroom wear a face shield. I think, that's not practical. And it's not right. I mean, he's exempt from the mask, but that's not the issue with him. He needs other people to be able to see their facial expressions. And I just hope you can do lots of therapy outside of school and work with them. And I can't hear you because you're muted.
I'd like to hear some thoughts. I don't want to jump in though, but.
Yeah, so anyway, but I don't think at this point, I don't feel, as much as I have empathy for you, I don't feel we can make, and I understand your argument completely. I don't think we're in a medical situation, a public health situation, that we can do anything about it right now.
Can I respond? I mean, the Pastor Schroeder was able to briefly. I appreciate that. Thank you. And it doesn't surprise me to hear that others have a similar situation in their families, because this is quite common. And I agree with you, of course, about the greater good, and I agree with you about public health. I'm not arguing for some kind of rights-based argument or something like that. I agree that we need to think about public health. And I also appreciate that you recognize that my son being exempt does not fix the problem. What I find troubling is that this mandate, the way that it is written, makes the burden of sacrifice for public health on children like my son, who are the most vulnerable children in society. And that seems wrong. And I also have to say that, and this is not every child is in this situation, but COVID has gone through our household. And so in addition to, we have very robust immunity in this household. My son is not going to be spreading the virus. And indeed, many children have gotten the virus. They have, even if they can't get vaccinated yet, many of them have natural immunity, and that is robust. There's an article in Nature that came out in May that suggested it may even be lifelong, and that was the write-up in the New York Times as well. You can look for it. And obviously further studies from Israel showing that natural immunity is quite robust. So even though children cannot get vaccinated yet, they are not spreading the virus. There's a study of almost 2 million children from Sweden, unmasked, without even distancing, indoors, and not a single child died out of 2 million. There were 6 hospitalizations. I mean, so I guess what's frustrating to me, and again, I won't give a lecture, I'll finish, but what's frustrating is I agree with you about public health, but this foisting the burden on children with communications disorders, which may affect their development for a lifetime, for a virus that they may have immunity for and do not spread in a school setting, is very troubling. And I do not think abides by the mandate, the mandate that this county has, this board has, to be public health minded.
And I think the problem with this is a novel virus. We're still learning lots about it. You're right, more information is coming out. But I think what we have to do as a public health board is to rely on information we get from our other organizations like the CDC. And that's basically what we have said. If the CDC comes out and says, hey guys, we don't have to do this, then that's another story. But right now, I think we have to rely on our public health informers, and the CDC is who we're those recommendations are what we're following right now. And I think as an individual board, I feel that we need to do that. I mean, I think that's where we are right now. At least I don't want to speak for all the board, but that's kind of what we've been talking about in the past.
It's little consolation, Dr. Elliott, but your situation is not the only one in which there's an indirect victim of this situation. There are many people who are being denied access to surgery and things of that sort, very important issues. And I fully sympathize with your case. I think it's very unjust, and we should have been all vaccinated about a year ago.
Yeah. And I do hope, despite your son's natural immunity, probably has some still, that you do go ahead, once it gets approved, get your kids vaccinated. So, because I think that's the one thing we can do in terms of, as a society, in terms of being able to change the rules, is to have a highly vaccinated population. And then we can talk about changing some of the rules then.
Any other discussion at this time? Once again, our choices. We can let the order expire. We can change part. Or we can extend it.
Well, let's throw it out there. I'll make a motion to extend the order until the end of October, which would be what, Margie? Is there a specific date for an extension? We're gonna do.
She gave, Penny said something about October 20th, so it would need to go beyond that. Was that correct, Penny? Did you mention October 20th?
Well, that was for.
Yeah, my mention was simply that sort of in my analogy about best case scenario would be October 20th.
That'd be for four weeks from now.
So what about, my motion will be to extend the order until October 31st, midnight. That's kind of what we did with this one, so.
We have a motion on the floor. Do I hear a second?
I'll second.
We have a motion and a second. Let's do a roll call. Board Member Cranor.
Yes.
Board Member Hageman.
Yes.
Board Member Norrell.
He left. He had to go to
Okay.
class.
Okay. Board Member Pritchard.
Yes.
Board Member Talukian.
Yes.
And Board Member Wren.
Yes.
And I also vote yes.
But I think I have lots of conflicts about it. But but I really think that people should voluntarily just mask up. And not, honestly, I just think they should do it voluntarily. I think we just have to be cautious about it. And I do appreciate there are issues that it's not a perfect world, but this is a really nasty virus.
Well, and we have another 30 days or so to increase our vaccination rates, try and educate the public more about wearing masks and why, and continue the effort. And, the ones that are out there and are doing the right thing, we really appreciate that. We need your help too, and to continue the communication and spreading the correct information.
Yeah.
My comment that we're really working for everybody's health, but if the numbers come back, statistics change from the CDC, we ought to be able to allow ourselves to reverse the process.
Absolutely.
Yeah.
Just to take the emotion at least partly out of this is that, we're all inconvenienced in one way or another, some more than others, by this whole pandemic. I mean, everyone has been at least somewhat. Some, and our situations are all different. But the fact is that the virus doesn't care if someone's disabled. They also don't care whether we're in church. They don't care. It doesn't care about anything except replicating itself and spreading. And so we attach a lot of emotion to this because it's of the effect that it has. But we have to divorce ourselves somewhat when we make these decisions from the emotions and try to do what's best for public health. And so these decisions are difficult, especially when we hear two people tonight present points of view that are extremely sympathetic, and it's not without the fact that we don't see the merits of your complaints, but it becomes onerous to try to cut out exemptions for certain situations, and all we can do is ask you to persevere. It's hopefully this will hopefully things will be better.
Yeah.
That's why we're working to make this better as quickly as we can. And one final word is we heard from a couple people tonight about studies saying this and that. Well, you can find a study that's going to support, and I'm telling you right from the CDC or the FDA, you can find a study that supports your point of view. But just as I was sitting here, I looked up a CDC study that was done just in November of 2020 in Kansas, masked and unmasked counties. And without question, the masked counties had a much lower rate of transmission. And the final statement was that seemed to be borne true in 15 states that had mask mandates as opposed to those that didn't. So anyway, that's my final 2 cents in this, but I'm not unsympathetic to both or all of the people.
And the other thing I want to point out in terms of all of our children is that they've already missed an entire year of school last year, and they've lost an entire year of general education. And one of the reasons the CDC has recommended the masks is in order to try to keep kids in school, so they're not having to shut down schools, go back to virtual learning, and having kids not go to school. So I really want to have our kids stay in school if we can, because they lost an entire year of learning last year.
And our children don't have an opportunity to get vaccinated yet. So our entire population of children under the age of 12 is our most vulnerable.
And some are more vulnerable than others because of their needs, but they're all vulnerable. And certainly, kids with the huge education gap that some of our our lower income and more disadvantaged kids are truly suffering from an education. And these issues will last them a lifetime as well. So it's not just the kids with developmental disabilities, it's all kids.
Well, and the hard part is we as a board are charged with protecting the public. And how can we do that? I don't know any other way to do it except vaccination, masking. And we know how we've told people wash your hands. We've told people socially distance, and we've tried numerous things, but masking and vaccination seems to be the things that work. Anything else?
I just want to thank you for your consideration, and I appreciate all you guys do. It's a tough job, and thank you for listening to the requests and for considering it.
Thank you for coming.
Yes, I appreciate your attitude. Thank you.
I do want to, just for clarification, and Margie may appreciate this. So the motion was that the current order would be extended. And so if we were to go to blue, if we were still to meet those things, it would still expire early, but otherwise it is the 31st of October. Okay.
Yeah, so essentially we're just going to change the date and everything else will stay the same. I do encourage you to think about, again, we've already got that built-in thing. If we suddenly go gangbusters and we get all better, we can remove it. But I mean, do think about if you're going to meet, and Penny and I talked about this a little bit yesterday, like when you're going to meet next. I know that you have got a regularly scheduled meeting. Was it October 5th or 6th, Penny?
It is the 5th.
You want to keep that date, or whether you want to sort of split the month of October. And, it's totally up to your call. But I do think having these regular meetings is a good thing, because you can be responsive to the public. You can hear these sorts of things. And I think, as a government lawyer, I think that we aren't required in Indiana to take public comment, but I love that we do. And I think we end up with better decisions and more thoughtful decisions, because you do hear from the public. We get these great comments like we had tonight, and that informs your decision. So I would encourage you to keep meeting regularly and keep up with listening to the public.
And thank you, Marcia. I totally agree with you. I think we should continue to have our frequent meetings because things change and hopefully they change for the better. But we do need to be able to adapt when things change. And I agree that meeting frequently is a great idea.
I'd like to thank the board for their careful consideration of these extra problems and how this all is evolving. And I totally agree with what you've done. And if there's a change, we'll do what we can to make things easier for people. We would probably consult one or two of you or three or whatever. We can always do an impromptu with two or three. We can't do a majority. So anyway, I appreciate all you've done. You have really given careful consideration to these problems. Thank you.
And thank you, Tom.
On another note of thanks, I'd like to thank Margie and Penny for a very professional day with the Seven Oaks folks.
Thank you.
Okay, we're down now to new business. Does anybody have any new business?
When are we having our next meeting?
Well, we're going down now to board member comments and then we'll decide, Steve. Any board member comments?
When are we having our next meeting?
When are we having our next meeting? October 5th, I heard.
October 5th is a regularly scheduled meeting.
Okay, I won't be here for that one. Sorry, but that doesn't mean you shouldn't have a meeting, but I just want to let you know.
And I cannot attend either. Steve and I had the same meetings.
That's just a one night thing? It's not like you're out of town for the whole week thing?
No, just one night.
Well, I cannot attend on the 6th. How about, October 4th? Or the following week?
Following week could be challenging for me.
Well, you may, as you're thinking about this, you're going to need to come back perhaps prior to this order expiring, which would probably mean you would want to meet the week of the 19th.
Well, just a suggestion, why don't we plan on meeting then that week, early in the week? And if we need to have a meeting earlier, then we can, Kate or you, Penny, can let us know. Unless you guys want to go ahead and meet on the 5th.
Well, I would say it's up to you. We do still have the potential for the variants to come back. They were not ready prior, but have said that they may want to bring that variance request back. And so just regular business that you would have. So whether you want to do it all in one night or not is totally up to you, but just to make this.
What if we do it on the 7th, Thursday the 7th, and then we can do, because I think that there's all this regular stuff too. And it's probably good to, and that's also after the Wednesday information comes in, which is kind of nice.
Okay, let me ask this question. Who cannot meet on October 7th?
Depending upon the time, I do have a 3 o'clock meeting that day.
Yeah, and I'm at the dental school that day.
How late do you guys go?
I'm tied up in the afternoon.
I have a 7 o'clock meeting.
We do a 5 o'clock meeting?
5 works.
That would work.
Does that work for you, Dave?
That might work, yeah.
You can attend a little late or leave early, whatever you need to do.
Well, it'd be if anything at all, I'd be slightly late, but that's a better night. I mean, it's a better time. So.
Okay.
So Thursday,
okay,
Thursday the 7th at 5?
October the 7th at 5 o'clock.
Thank you.
Okay.
Thank you, everyone.
Do you want to go ahead and schedule the next one?
Yeah, for a regular meeting.
Okay.
Oh, you mean for
before the 30th.
So that would be the week of the 18th. I'm open.
Maybe we could do it either Wednesday or Thursday, so we get the county data in.
I'm sorry, Carol.
Yeah, sorry, Kay. I was like, what?
Did you say Thursday, Carol?
Yeah, I just said because we want to do it either Wednesday or Thursday so we can get the county data in before so as opposed to earlier in the week.
Okay, how about October 20th on Wednesday? Is there anyone who cannot attend?
Margie can't.
I have a Parks Board meeting at 3:30 that day. Generally, they last about 5:30, but I can always get another attorney to sit in for one, trying to get one of the other attorneys to sit in one of those.
Yeah, I think it's really important for you to be here for this because we need your expertise when we're talking about these regulations. So
I can see.
Let's look at the next day. Let's look at October. Let's look at Thursday, October 21st.
That works.
Okay.
I'm good.
That work for everybody?
Yeah.
Okay, let's say October 21st at, shall we say 3 o'clock?
I can make 3. I could make 5.
You can make 5? Let's say October 21st at 5 o'clock.
All right.
Hey, got it.
Okay, Penny, did you get those?
Yes, we will get those posted.
Okay. Well, thanks, everybody. I know you feel drained. I'll see you then on October the 7th at 5 p.m.
Thank you.
Our journey.
Bye.
Bye.
Thank
Have
you.
a great week, guys.
Thanks, guys.
Bye-bye.